So that I'm respectful of the time of the presenters who will follow us, I'm going to start. And I think probably, as you know from this morning, I'm Patty Franklin. I'm also an assistant professor at the University School of Nursing and director of the Leadership Institute at this school, as well as director of professional education. And my co-director at the Leadership Institute.
Hi, some of you may know me and some may not. I am Kathy Montgomery, and I am an associate professor and chair of Partnerships, Professional Education and Practice here at the School of Nursing. And that's a relatively new entity within the school, that it comprises the Education Institute, the Office of Professional Education, the simulation footprint in the school, as well as global health, and I think I have gotten it. And the faculty practice. So it's a large scope and a nice chance to express leadership in. So thank you.
And the School of Nursing certainly wants to recognize the generous support and creative vision of the Maryland Health Service Cost Review Commission and the Maryland Higher Education Commission for launching and sustaining the Nurse Leadership Institute. We thank them. So before we really get into the nitty-gritty, I have a question for you. Has it been your observation that there's been a recent uptick in the conversations and in the literature on a focus on leadership? Raise your hand if you think you've seen. Right. I thought it was my bias because, well, I'm directing this Leadership Institute. But anyway, I thought there was an increase, and so I went and did a very crude lit search using the University of Maryland's Health Science and Human Services Library's online One Search that includes about 60 databases. So I selected articles, I searched for articles with the word leadership in the title. And since 1872, there were about 243,766 articles published. So I moved that little cursor over, and in the last 10 years, 57% of those publications had been printed in the last 10 years, and about 43% since the IOM's recommendation on the future of nursing. So yes, there's been more attention, more dialogue, more written about the need for leadership in healthcare. So why? Why this attention to leadership? Well, as we can see, there are we know that there are several reasons. One of them is the trends for health outcomes to the U.S. citizens, and also including Maryland, are not improving. We've seen a steady decline in health outcomes. And we know that in 2014, 65% of Maryland adults were either overweight or obese. And we know the association with chronic illness and obesity, such as diabetes. And these are national annual numbers in the thousands of new cases of diagnosed diabetes among adults that are age 18 to 79. So our health trends are not improving, and therefore it's a clear call to improved designs for delivering health care and improving health outcomes. Maryland is committed to reforming its healthcare system so that citizens receive quality care that improves health outcomes. So the vision is, and it echoes the IOM report, that nurses in Maryland are full partners in redesigning Maryland's health care systems. So in 2013, the Health Services Cost Review Commission awarded Johns Hopkins University School of Nursing a 2-year grant to increase leadership capacity in nurse faculty. It was a 2-year grant-funded program. It was a consortium between 5 colleges. They had 2 cohorts of 20 nurse faculty each. Each of those cohorts went through a 1-year leadership academy training, and their results will be coming out shortly. But overall, it was successful in increasing the skills within those faculty members. But the Healthcare Cost Review Commission and MHEC also said, well, that's just part of the equation. There's another piece to the equation, and that is we need nurses from healthcare delivery systems as well, developing their leadership capacity and collaborating with academic faculty to improve not only the education and preparation of nurses to assume various roles, as well as be prepared to really affect the design of healthcare models. So they decided to expand the model that they originated with the Johns Hopkins Leadership Program, and they expanded it both in scope. It's now a statewide initiative. All schools of nursing may participate, and all nurses in healthcare systems, healthcare delivery systems, may participate. And there's criteria. They need to be graduate preparation, and a number of criteria that are detailed on our website. And also that this next grant was to be 5 years, which really gives us an opportunity to do some long-term and longitudinal study on the effect of a leadership training program. And so we in collaboration designed a Nurse Leadership Institute. And the purpose of this institute is to build Maryland's nursing leadership capacity by developing individual leadership competencies, preparing nurses to assume leadership roles in a variety of forums, and contributing to a statewide network of leaders. Further, to develop and implement, these participants will develop and implement strategies that effectively and efficiently prepare nurses for assuming roles across the continuum of care, shaping effective models of health care that are improving health outcomes of Maryland citizens. Grand design, so we had to have some pretty neat people to be partners with. And so this is our Nurse Leadership Institute team. Myself and Kathy are the leads. And then we also have faculty from the School of Nursing, as well as a nurse practitioner from UMMC that is working with us. We also have a representative advisory council. We have 7 departments and schools of nursing represented on our advisory council, plus 6 healthcare service centers, and the Maryland Healthcare Education Institute that are sitting on our advisory council. And we really saw them as having a partnership role. And we want them to, and we engage them in promoting and recruiting applicants, providing critical assessment and feedback, which we respond to, and assisting in planning for the future, as well as, and this is really important, leveraging their networks. We're preparing these leaders. We need to have opportunity for these leaders to step into roles that will be effective in changing policies. So I'm going to turn this over to Dr. Montgomery, who will talk about the vision for this particular program.
So you look at this comic and you look at the 8 styles or types of leaders, and I'm sure you're going to pick yourself out, or maybe you have a combination of 1 or 2. Our focus really in this course and in the Institute is to really build beyond the positional leader. Many of these are representative of positional leaders, and being able to look at the much broader contemporary leadership opportunities for nurses that may span, as Patty has shared, a wide range of forums and activities. We think that type of leadership gives the opportunity to affect positive change beyond some of our traditional roles. And so you'd say, why the change? Why are we doing that? We know more and more that our work is about knowledge work. We heard some of that this morning in certainly this study that Dr. Fountain talked about. And we know that in nursing, it's the translation of that knowledge through the critical thinking and the judgments that we make for the patients that we care for the systems that we lead, for the teams that we participate on. And being able to really prepare our leaders in the state of Maryland is a wonderful gift for us to really make a difference in this new world where power is more distributed. The traditional role of the leader was it stemmed from the top. We've come a long way in the last 20 years where we have had distribution of power. So it's where the change is constant and where the necessity for the leader to possess that knowledge and to be able to have that knowledge shared across the leadership of nursing wherever the forum be. So preparing nurses is really essential to meet that goal of affecting change in the healthcare system that is positive across all the different platforms in the state of Maryland, including the hospital industry, as well as the changes that have been imposed with the ACA and our own state waiver. It's essential for the leaders, and this is a key part of what they obtain in their program in the Institute, is self-knowledge. How their own styles, their own biases, their own schema about things affects how they lead. So that self-knowledge is a really important part of being able to use one's own capacity and the opportunities in this new world of leadership. And it's no longer, as we once knew, from a top down. So leadership is conceptualized in this program that we have had in a very broad way as a philosophical and developmental relationship between people that share a common purpose, motivation, and values. And this particular framework is threaded through each part of the program that you will hear more about leadership that facilitates the value of organizations, the team, the unit, the policy development or implementation, again, all of the different forums where the leader is using influence, expert power, and really collaboration. This is no longer a solo act. We are preparing people who know how to navigate and establish the kind of networks necessary and the kind of collaboration necessary to affect change. Change in these complex adaptive systems, they're not linear, they're unpredictable, they have, again, distribution of power, there's a value orientation, it's no longer volume, we're hearing more about that as new models for payment are coming across and being looked at, and it's very connected. That network that was highlighted earlier and we highlight throughout the program is the necessity for these relationships, collaborations, and partnerships to really be able to be essential to the kind of innovation and the kind of finding solutions that are really going to make a difference in this new world of healthcare and complex adaptive systems. So the program begins, as you could see, the components of the Nurse Leadership Institute in the far left box, that the leadership development program, and the expert faculty and the representative council that you've heard about, and our attempts at continuous evaluation of the process. It's 12 months. It has education and training and intensive leadership training during large chunks of time where our fellows have enjoyed not only creating a new network among and between themselves, but also drilling very down deep into their self-knowledge. That also has simulation, expert coaching, mentorship, and again, that necessity to develop a network. They're very tightly knit, lived experience together. And the product is a collaborative project that they work across between the academic and practice setting and with different collaborators, and they've been very creative to date on how that has been operationalized. So our hope then is to launch these leaders, track them over time, have each group join the next network of cohort of fellows, and institutional and regional, state, and national impact. So that's kind of the program in its entirety, in the large swipes of it. And our expectations of the fellows is to have the level of commitment, to really be able to pull themselves away from all the distractions, which is sometimes a very big challenge for leaders, have a level of participation and engagement, and again, the famous word, collaboration among and between and across their programs, and to be able to see some achievement, which you will see some of our first group coming up when they graduate in August. So this is really where we have our expectations for our fellows, and that added feature in this new phase of leadership development included the mentors. We also work with commitment, participation, collaboration, and achievement with the mentors. So we do that in lots of different ways throughout the intense program, and then follow on web conferencing and subsequent conversations about their successes and challenges in preparation to be mentors in this program. So this one is really about what can a fellow or a mentor expect from us, and we've been highly committed to their development and responsive to their different needs, and we provide expert faculty, evidence-based training, as well as appropriate resources and support to get them through this very significant and intense year. Many of our first cohort mentors would say, I'm coming back and going to be a fellow next year, and have been very pleased with the experience that they've had, which Patty is going to carry on and tell you more about.
And you're keeping us on.
Yeah.
Thank you. I got 10 minutes. All right, so we started in September of 2015, our first cohort of 20. We had a nice mix of PhD and doctoral prepared nurses at the MSN level. We had 60% university or college school of nursing faculty and 40% from health service agencies. The cohort represented 9 universities and 4 different health service agencies. 7 counties in Maryland were represented by this cohort, but this is a statewide initiative, and we really want this to represent a statewide initiative, so we encourage you to help us make that goal. So year to date, 2015, the grant was awarded. We made our first call for application. It was a quick turnaround. Review and selection, October. The first cohort met here for orientation. We did a quick evaluation of that orientation. We continued with follow-up communication and preparation for their intensive training. And in December, the fellows initiated their individual assessment processes. And in January of this year, met for a week-long intensive training workshop. And I know at least one fellow is here, and you might want to talk with her later. It was very intensive, and we've learned from that. In February, they began their collaborative projects. We've continued with monthly communication. We've had, as Dr. Montgomery has mentioned, we also held some conference calls with our mentors to check in. How are things going? What do you need? And what else can we help you with? And then in April, we launched our next call for applications. The deadline was last week, and we are processing them now. Our evaluation design is fairly standard in terms of formative and summative yearly, focusing on the individual and program, but what we're very excited about and working with our grant team is really looking at longitudinal study and really seeing what the outcome is in terms of nurses participating in a leadership program. So we will look at the individual, we will also look at the cohorts, and we will see how the program results also evolve over time. The evaluation, the first orientation, the cohort believed, they indicated, as you can see, that the context we gave them for practice, research, education, and policy was relevant to the goals that they imagined and came to this leadership program with, and our faculty gave great presentations and were quite relevant to what they were anticipating. The training, the intensive training program, as you can see, also had really good, highly positive results. The overall satisfaction, the mean was 4.85. And I think what's really impressive is a standard deviation of 0.37. They really felt this intensive training was a remarkable experience, an informative experience. They also felt that the application to their individual role, that's a little r, it shouldn't be a little r, I know that would be statistically confusing. But they, again, 4.85, and I did not make these numbers up. I mean, this is what it was. The standard deviation of 0.37. But also, too, the application to their organization, they felt, was very relevant, was highly relevant. So we really do believe that this training program that we've partnered with UMUC has been quite effective. Our formative results, our fellows needed a lot more information a lot quicker and a lot earlier. So we have undergone development of our webpage to give a full year's program detail along with dates, and as well as criteria and the application process. So I think that has helped in people understanding what type of program this is. Curiously, we got some results from the Johns Hopkins later on, and as well it lines up with some of the results that we got from our formative analysis. And that is a week-long training program is a huge burden on people in terms of time commitment and resource. And we want to make this an accessible program to health service agencies, and to take a whole week out of their work week and dedicate it off-site to their training was a significant burden. It's also an emotional experience and burden. And we don't want to, we want to make sure that this program is both helpful and it doesn't take them out of, their work environment physically, emotionally for any length of time. So what we've decided to do and worked with UMUC to do is to package these, to deconstruct it a bit and get 3 days of intensive training, and then have a simulation program later and separately, and then another program. So they still get their 5 days of training, but it's parsed out. So it's not such an overwhelming experience, and hopefully we'll see continued good results with that. The leadership there is by Dr. Alice Black from Ohio State University developed a leadership program outcomes measure tool. So we are using that. It has great validity and reliability, and we're going to be using that to really track the effect of this. The team projects are due this August in their last day, and they're collaborative processes and projects that have design and method and implementation that they will report on. So we have 5 minutes. Yep. Whoa, and that's for our question and answer. So next presentation, and that is, oh, you're welcome.